Well, yes, at Cardiff and Vale we are committed to the ongoing development of our staff. They're our biggest asset. The PADR process helps to ensure that staff are supported to be effective in their jobs and committed to developing and maintaining high quality services for the public. Evidence suggests there are many benefits to appraisals, such as improved employee engagement, improved performance and patient outcomes. This is your opportunity to have protected time with your line manager or your supervisor, away from the busy workplace, a one-to-one discussion about your work objectives, your development and future goals. The following staff will share their experiences of the PADR process.
I started my career within Cardiff and Vale on the Accelerated Development Programme, which is run in the Mental Health Clinical Boards. That programme is a development programme over 2 years, which you work in 4 different areas at 6 months of a time, giving you different experiences in different clinical areas. Following that then, I started being kind of recommended within PADRs to go for deputy manager roles, which I was successful in gaining. Since then, I have been working with an interest in education, which then led me to apply for a job within the Learning and Education Development Department in Cardiff and Vale, and I'm currently a Healthcare Support Worker Development Manager.
Well, I began in community nursing about 26 years ago. I started on the out-of-hours service. That was on a part-time basis. From that, but my children were young, so that suited me at the time. After that, I went full-time as a treatment nurse for Cardiff and Vale in primary care again. And then since I took early retirement, I've come back on a part-time basis in the education role.
So I've been qualified for 10 years. I did my degree in Cardiff University, initially went to work in the neonatal unit up in Prince Charles Hospital in Merthyr, and then came here about 6 years ago to UHW and as a band 5, progressed slowly, worked my way up to a band 6 role, and which I've been in for about 2 years now. Recently taken on the role of the off-duty and work clinically full-time on the neonatal unit.
I've been with the health board now for a little over 5 years. I started the first 2 years of my career training with the Media Resources Centre and studying for my postgraduate certificate with Cardiff University. I was fortunate then to be offered a permanent job and so I've been a qualified photographer now for about 3 years.
I've had a number of PADRs during my employment with Cardiff and Vale. Some of them have been done by practice development nurses and others have been done by ward managers, and since being in LED, other managers within LED, including the head of LED. These PADRs have really helped me enhance my education as well as opportunities within work for personal and professional growth. They have given me the opportunity to start on a master's pathway, which I'm lucky enough to be completing now in January. They've given me opportunities and training that I never thought would have been available to me, but we came up with objectives and then to meet those objectives looked at what training was required for it.
Really positive actually. From the outset I identified that education was a real interest for me. So in every role I've had, that's been encouraged by my senior managers, and they've enabled me to be released and seconded to be an associate lecturer. They've encouraged me to gain my PGCE, and now they've re-employed me in that education role where I'm delivering educational packages within primary care and the nursing home sector.
In the neonatal unit, we've got a manager who's very proactive with PADRs. There's constant reminders on the boards, so I have a yearly PADR. It gives me the opportunity, being from quite a busy area, which neonatal is, to have protected time with her and be able to set out my career goals for the months ahead and the years as well, which is really beneficial, being from such a big group of nurses. Just to have my pathway set out formally is really good.
So since being a qualified photographer, I've had 3 PADR review meetings, all of which have been very successful and supported highly by my manager. The objectives that I've set within the 3 years have all been successful, and have all boosted my knowledge and skills within my role and increased my confidence in areas that I previously struggled with.
I think future plans have been set within my last PADR whilst we looked at the next year's objectives and how we were going to achieve them, but we started looking further afield. My main priority at the moment is completing my Masters. With the support of that PADR process, we're able to identify objectives to help complete that. Once that is over, we're looking forward to the next PADR to focus on future goals then.
To develop in the role that I'm currently in, it's always evolving, there's always something else. I'm currently leading on the ANTT within the UHB, within primary care. I've been asked to be an internal verifier to support other nurses in education who are involved in marking and assessing some of our staff. So that's quite a significant development for me, and it's just an added part of the educational role. So I'm grateful really to be supported in doing that.
Having done my PADR a couple of weeks ago, I think my plan is definitely to do my Masters. I've done my degree, so working with Cardiff University to get on the Masters programme, and hopefully the next stage for me is a Band 7 role on the neonatal unit, staying clinical.
So over the last few years, my objectives have supported my personal development and progression, and over the last 18 months I've been working towards my management level 4 qualification with ACT training. In the new year, upon completion, I hope this will support my personal progression within my department, and I strive to become a manager in the future.